Well, welcome to Brivia's quarterly special guest conversation, where today we'll be chatting with Brenda Badiuk, who is the president and COO of Seven Oaks General Hospital. I'm really excited for today's conversation. My name is Steve Smit, and I am Brivia's vice president of market development. So for today, we've scheduled 45 minutes. And what we're hoping to have that Brenda and Steve Groot are going to share, but we'd also like to hear from you, the audience. And I'm going to get you a chance to do that right away. So I am joining from my home office in Airdrie, Alberta, Canada, which is just north of Calgary. And my hope for everyone on our webinar with us today is that you come away from this encouraged. I know whenever I get a chance to talk with Brenda and Steve about this story, I get very encouraged. So I really hope that you get a chance to do that as well. So I have some questions for you, as we like to keep this quite interactive with our audience. 2 questions today. Where are you joining us from? And what are you hoping out of today's time together? So if you could just put those in the chat, that'd be super helpful. And we can kind of start getting used to everyone just chatting with us and telling us where they're joining us from today. Awesome. While you're filling up the chat, I'm going to bring in our special guest here today, Brenda Badiuk, President and COO of Seven Oaks Hospital. Welcome, Brenda.
Thanks, Steve.
Brenda, do you mind, great green shirt, by the way, St. Paddy's Day, we'll point that out. Do you mind telling us a little bit about yourself, where you're joining us from today, and what you're hoping the audience takes away from our time together today?
Certainly. I am joining you from Winnipeg, Manitoba, actually in my office at Seven Oaks General Hospital. And I on the screen, but the rest of me and certainly my team is such a good news story to share. So I'm looking forward to sharing our story. I'm looking forward to giving people some hope that it's not that complex or difficult. It takes some discipline and some intention.
Awesome. Thanks, Brenda. Thanks again for joining us today. Now I'm going to bring in Steve. I may not need to introduce you to a lot of you folks that have been following Brivia for a while, but Steve Groot, our president and co-founder of Brivia. Welcome, Steve. Thanks for coming into as well.
Hey, everybody. Hi, Steve. Hi, Brenda. I'm so excited to be here today. Yeah, I'm in Toronto, Canada. I just came out of the closet as being bi-provincial. Winnipegger, Toronto. It's so great to see people in the chat from all over Canada and other parts of the world. I'm excited to be here. This is such a great story and a great journey. So I wanted, what I'm hoping for today, I am hoping that everyone, especially leaders today, can hear this amazing story to learn and just confirm that you don't have to wait. The right support at the right time, at the right place can have an absolute profound impact on the people you're responsible for, even within and through unimaginable disruption. So that's what I'm hoping, that the people that took time to show up today can be inspired, but also can have some hope about what's capable and what we're all capable of. Thanks, Steve.
Awesome. Thank you. So let's get right into this. We've talked about a lot of disruption that happened at Seven Oaks even before you joined, Brenda. So there's been a lot going on there in the last 4.5 years. Why don't you take us through some of the things that have been going on there?
Sure. And got to tell you, it gave me a bit of heart palpitations when I put this list together for this presentation, because when you're going through it, it has a different feel than when you look back. But our health transformation in Manitoba started really in June 2017 with a 15% management position reduction across the whole system. And that was quite difficult. I came to Seven Oaks General Hospital in September 2018. And between September 2018 and 2019, we had massive change in the system as a whole, but in the hospital in particular. We had profound loss at our hospital, loss of identity, loss of staff, loss of services, and many of them were services we were extraordinarily proud of. So we lost our general surgery, our OR staff, our recovery room staff, our ortho trauma program, which was a real point of pride, our ICU, our mental health, our geriatric mental health, our emergency converted to an urgent care, and our medicine converted to a lower acuity, which meant a change in staffing ratios. All in all, it had two significant labor disruptions. It impacted directly about 800 staff and indirectly everybody. And those labor disruptions happened 6 months apart. So that was profound. I then, in November, went to my board and said, I need some support. And I am profoundly thankful to the Seven Oaks Board of Trustees. They heard my concerns and they said, do what you need to do to stabilize the team. And that's when we formed the relationship with Brivia. Yeah. We had a session in November with the leaders, and then started the full leadership, the greater leadership session in March. Coincidentally, the same day the pandemic was declared.
Yeah. Well, even before that, Brenda, even if I can jump in, I mean, just the disruption that you mentioned in the beginning, I think it's unbelievable just in and of itself. I met Brenda at a conference well before, at a leadership conference, and she reached out and we agreed, that leadership capacity is central to an organization's ability to succeed in the normal circumstances. We had no idea at the time what was about to happen, right? And when we started, Brenda, as you're saying, our first day, March 12th, in the training room in the Seven Oaks General Hospital, everybody went away for the break. It was close to 10 o'clock in the morning. No one is ever late. Nobody's showing back up. I have two managers come in and I'm like, what's going on? They said, we just had our first presumptive case just now, ground zero in Manitoba. And that was when we started working together. And that was unbelievable. Back to you, Brenda.
Yeah, so there's a turning point and a decision point. And so we really worked with Steve. Okay, how can we do this? Because we can't do it the way we were intending to do it initially. And we made the decision, okay, we need to continue to push through, because the pandemic was another layer of massive disruption in a really unstable environment. And I was very concerned about my team. So we pivoted, we went remote, we figured out how to experiment and try some different things, and continued to lean in on supporting the leaders through some definite programming.
And I think it's really important to acknowledge, Brenda, at that time, a lot of people were saying, stop, let's wait. And Brenda just said, no, her and her executive team said, no, let's keep going. We can't stop. Our leaders need to be supported. And that was impressive, to work through challenging times, right? There were outbreaks going on, right? I think it's important to keep in mind that when other people are deciding, do I want to work from home or not? It's stressful to go into the office. Well, imagine going into the office when there's a breakout at the office, right? It was unbelievable. And then you're absolutely right. We started to continue and do several things that started to make a difference, Brenda.
And even the pandemic and our response to the pandemic at the hospital level was evolving, right? At first, we weren't going to see any COVID positive patients other than potentially in urgent care. But then we have dialysis patients, and we have to continue to treat dialysis patients regardless of their status. So we had to pivot there. We ended up having COVID positive patients on a unit. We ended up setting up a COVID unit a couple of times. We stood up a unit and supporting the community hospitals outside of our, with being able to take care of COVID positive patients. We did have the outbreaks. We had numerous outbreaks. We had 13 loss of life of our patients, which was or 14 losses of life. And then staff started getting sick, so it was, well, as everyone knows, everyone's lived that piece. During this time also on the timeline, we were continuing to do the transformation that was necessary for the system. So my executive team, we removed a role throughout the whole system. The chief admin officers were eliminated. So we reduced the executive team from 5 to 4 and had to absorb those portfolio responsibilities. And then in our clinical side, we reduced our clinical directors from 4 to 3. So we amalgamated our family medicine and rehab Jerry under one director, which is a profoundly big move. Like, that is not insignificant. And then in October, we had a staff member tried to kill one of our managers right in our atrium. It was an egregious assault. It was out of the blue. She survived, which is awesome, but it was very, very grievous. She was very grievously injured.
Yeah. Yeah. And that was a horrific incident. And, we never, as the pandemic unfolded and all the different changes and the different, the magnitude of disruption, nobody would have expected that. And, this incident for me as a partner in this, this is where the strength of the leadership team shone through, right? People were stating unequivocally that their leader support was a major factor in how well they were doing. Like this was in the third wave of the pandemic. And I think what's important to know is, what we started to see is people wanted to be at work and not at home. Now, I've been involved in many tragic events involving patients, clients, and employees throughout my career, and I've never seen anything like this type of resilient response. It was even with my optimistic perspective, it exceeded that by leaps and bounds, and it was pretty impressive.
Mm-hmm. So Brenda, thanks for sharing this with us. And Steve, your comments, it's amazing. I want to go back to one point in the timeline, April 2020. And Steve, you mentioned this, that a lot of companies, a lot of organizations said, pause, let's just stop, let's focus in on the pandemic. Brenda, you and the team there at Seven Oaks made the decision to not only continue the work with Brivia, but to expand it. So what did you focus on? What was the main focus as we transition here to this? I just wanted you to think about that and maybe answer that question for us.
Yeah, and I want to throw it to Brenda because Brenda didn't even blink. And as I said earlier, there was dozens of people that we were working with that said we got to stop, we got to wait, and Brenda said let's keep going. It was so impressive that she understood the need for leader support, and she was very clear. I need to take care of my leaders so that they can take care of their people, so that we can take care of our patients. It was inspiring, and so we just kept going. And Brenda, over to you.
Yeah, and it was important. We were being rocked. We were being rocked prior to engaging with Brivia and then throughout. And so it was how do we connect? How do we connect differently in a pandemic? It's not as much of a gathering face to face. How do we maintain that connection? How do I ensure my staff feel safe? Because people were saying, I don't feel safe. And we needed to get underneath what that was and meet their needs, not necessarily what they were saying, but what they meant underneath what they were saying. We needed clarity. People want to know what's the direction, what's the focus, what's the purpose, what is my role, what are my expectations. So we really focused on that, and we focused on control. People need to know what's in their bailiwick and what isn't. They need to have the confidence that they have the skills and abilities to manage through this, and that we've got them. So yeah, you have the skills and abilities to do this. You have peers that will support you. You have clear escalations, and we've got you. We will coach, we will support, and we formed some structures to help with that.
Yeah,
fantastic. Yeah, Steve. And sorry, the comment that I saw in here is courageous leadership, and I just say absolutely. Steve, we're talking about the 3 great states on this slide here. Yeah. For those in our audience that may not know what those are, do you mind explaining those a little bit for us?
Yeah, absolutely. And I thought I knew what courageous was, until I witnessed the leadership at Seven Oaks General Hospital. Not to play down any other time, but I've never seen anything like this. And absolutely, Brenda mentioned 3 important words. Part of our research and the work that we do at Brivia is the importance of connection, clarity, and control/confidence, right? And one of the things in an uncertain, scary time, those are the things that humans need. So one of the approaches that we took, and Brenda was really clear on this, she used the words, we need people to feel supported and that they matter. So what we did is we started to use a similar language around the 3 great states. How can we create safety in an unsafe time? How do we create a sense of significance, which is how do we operationalize that people matter, that they're valued, that they feel supported, that they have their back, and how do we keep them situated? Like Brenda was really clear, right down to the ground on do people know what matters most right now in this moment? What's the next step? And just keeping one foot in front of it, in front of the other. So that's what the 3 great states were. And what made them important is that all the leaders at Seven Oaks General Hospital worked together to provide connection, clarity, and control by providing the 3 great states. And it had a significant impact on the environment during this time.
Mhm, mhm. And Brenda, how were you confident? Like you knew leader support was important. How did you know it was going to work? How did you know it was going to make a difference?
Well, the theory is the theory, right? So you know connection matters. You know relationships matter. You know communication is the holy grail. I needed a how. How can I do this? How can I do this at this juncture, at this time, with these barriers and restrictions? And that's where I had the help. You know, I have known, I have studied, I know the theory, but how to action it in a way that we can have a common language and common anchors and common points of connection, that's the help I needed, and that's the help I got.
Mm-hmm. Mm-hmm. And a question came in from the audience here. How did you keep this as a top priority for the leadership team? I know we're going to get into some of the mechanisms, but I'm wondering if you can talk about how you kept this the priority.
We had a cadence, and it was organically created. We did not have a, you know, here's an outline of the next 2 years. We were building it as we were living it. But it was a cadence of every couple of months. We had a touch point of intentionality, I will call it. So whether it was a booster session, whether it was a new material, we stood up some communities of practice, but we made this a continuous support. And, you know, if we totally understood if people couldn't attend as well, but they did. When we asked them, okay, we're in wave, whatever it is in the beginning, do you want to put a hold on this? They said, no, it's important. The community of practice is fully voluntary. We routinely get 20 people there. And these are managers, and you know, if you have a manager attending an hour, they're working an extra hour because they have to get their work done.
Yeah, and I want to just emphasize as well, Brenda and Steve. A lot of people have touchpoint huddles, but we were able to redesign the touchpoint huddle to give Brenda and her team, you know, daily touch points that were effective and efficient, that didn't take up a lot of time. And as a matter of fact, you know, we started to understand what was possible in this type of environment by setting up touchpoint huddles consistently that were efficient and effective, that just got to the things that were important, like how are you doing, what's going well, what do you need, what's most important, and what do you need from us. And it was, Brenda, if you want to speak to that. I mean, I thought I knew efficiency before this moment, but I'm like, I didn't even know this was possible. For those that know me, I'm a little bit over optimistic, right? I was born with the optimistic bias, but can you speak to the touchpoint huddles and how you're still doing them?
Oh yeah, no, that was one of the first things we stood up after the declaration of the pandemic, you know, because that's when we had to go remote, and that's where people were feeling very disconnected and very unsettled, right, dysregulated. So we set up that touchpoint huddle of what is going well, and it gave me, and I think I was one of the more dysregulated people, because I can remember telling you, Steve, I need to know they're okay.
Yeah.
I need to know who isn't okay and where we need to focus. And so we came up with this huddle where we just said, you know, what's going well, where do we need to support, and let's take care of each other, kind of thing. Yeah. And it was hugely helpful. And that touchpoint huddle has metamorphosized through these couple of years, where we were able to let that one go as the wave continued, and we settled, and we came to different sets of huddles. And then when that attempted murder happened, we were able to reconvene that touchpoint huddle at a different time of the day. It was at 3:00 in the afternoon, I believe. And it was, how are you? And because we had set that safety and we had that cadence of connecting, we could just say, how are you? And people, if they couldn't go on camera, they didn't go on camera. If they couldn't talk without weeping, they would put it in the chat. But I was able to know, okay, who's where. My executive team was able to know. This isn't a me, this is an us, right? My exec team were able to know, my directors were able to know, who do we need to touch? Who do we need to support? We have now metamorphosized the daily touch point into a safety and ops huddle, where I just came off of it actually from 10:15 until 10:40. We very rarely go beyond that. I get 51 reports from my entire leadership team on what safety events are happening, what concerns, what barriers, what celebrations.
Right.
We had a whole lot of St. Patrick's Day backdrops today.
Yeah, and I think what's amazing is we have other clients that say, we've got 12 people we can't meet, it takes an hour, and I said, you have no idea. 50 people in 20 minutes, everybody speaking consistently, effectively, efficiently. And I think everyone, what I hope towards as we get to the questions and get towards some of the thoughts and some of the practical stuff, I did want to just mention, Brenda, the importance backing up a little bit to, you provided some coaching, which was key to your key connectors that we call them, your leadership team, but also you talked about the importance of a common language, right? And so the next couple of things that came next early in the pandemic were responsive communication, equipping everybody with the language to speak similarly and as efficiently and as effectively as possible. And we also offered, and this is where we shifted from leadership support, and this was impressive, to Brenda started, and her leadership team started to do leadership development at a time. So not only were people drawing back on the support, she doubled down and we offered what was called Connecting in Crisis, which we built together actually to provide, managers and their teams with very practical strategies on how to respond to a serious change in crisis without dropping the ball, but also not without dropping the ball, but increasing your ability to work more effectively. I'm not sure, Brenda, if you wanted to talk about the communication and the Connecting in Crisis piece.
Sure. The response that common language is gold. And it's interesting because I've gone through lots of different process improvement and spoken Japanese for some of the process improvement and used other language terms. But what this did was, how are we asking questions? And how are we asking questions to get beyond, we need more staff, I feel unsafe, to what do you really mean? And that's what we were able to teach the staff, how to paraphrase back, how to say, tell me more, tell me more about that. Or how do you see that making a difference? What difference do you see if we did that? And we all had the same types of questions. So, if you're coming to me saying something, you expect me to ask those types of questions. And that seeking to understand is now embedding throughout the leaders here.
Right. Right. And less swirling, right? That's a common term I learned in health through the pandemic, that, to stop the swirling and move from all the information, all the different parts, to specific meaning in a short period of time, so that people can work as efficiently and as effectively as possible. And also, Brenda,
sorry.
No, go ahead, please.
Connecting in crisis, that's that regulating the dysregulated, right? That's the swirl. Yeah. Dysregulation is swirl, and usually it's not positive emotions under swirl. And so what we really tried to figure out is how to anchor people back, and we ripped off and duplicated a phrase of lend your calm.
Yeah, from good friend Dr. Jean Clinton from Ontario. Some people on the line know who she is, and she knows you as well, Brenda. So yes, you took that.
So cup of calm, lend your calm. Who has calm I can borrow? But that became the phrase that we used to say, hey, I'm starting in a spin, I need some support. And it's a phrase we all use, we laugh, but as soon as you name it, you start to regulate, right? Yeah. And so we can't be in a spin. Nothing positive happens in a spin.
Yeah. Yeah. And Brenda, you also, I think it's important for people to know, because some people, and we're going to get to where people can start and what our thoughts are going to be on how they can move this, because, one of the things is, not only did you double down on the development, but everybody worked together to find the space and the time to make things fit, right, within the realities of the current workplace. And so we did some leader booster sessions, which were really neat, because it just provided boosters to hold up the training that people were doing, so that they didn't lose it and they can continue to work through it. But the community of practice was very important to you. Can you talk about that piece, why it was important, and what you did to support the leadership team?
Yeah, well, we need to be able to lead this here. We will not have an option of always having external support or the money to support external support at the level we've had in the past couple of years. And really knowing sustainability is embedding this into the culture of the place. And that is having the people own it. And my managers in their community of practice are owning it. They are coming out with the most profound learning and statements. Like the last community of practice, having one of my managers, Sarah, say, for patients who have responsive behaviors, that figuring out what it's safe means to them is worth more than any PRN sedative we could give them. That is profound.
Yeah.
And that is not something we can just go, yup in a seminar.
Right.
That's her taking this to a different level.
Right.
And that's what a community of practice brings you. They start to own it.
Yeah, and they start to become champions of the work that's been done, so that the internal capacity can be built. And I know we're going to move on because we're also going to talk about what are the notable things that we measured or seen as a result of the input and the development. But before we say that, the Building Resilience Through Change program was also developed during that time, which was an additional support for your managers. But we can talk about that at another time. Steve, you've moved on. Please bring us back. Bring us back.
Remarkable improvement. So let's talk about these. Brenda, I know these top three mean something to you, so maybe you can take us through these, some of these notable improvements.
Yeah, and I would love to show you graphs and stats that say, hey, from pre-engagement to post-engagement, but we have been so turned upside down, we don't have apples to compare to apples. Right. So in the relationships where I am seeing the notable improvements are the relationships between manager and manager. So allied health manager and a nursing manager, which can sometimes be antagonistic. It isn't antagonistic. People pick up a phone. People will raise at the huddle, hey, I see your calendar's blocked and I really need to get a hold of you. I'm going to take this offline and can we have a chat? People going on the call saying, hey, I've blocked my calendar because for the next 3 days, I have something very time sensitive to do. And people aren't pointing fingers and blaming. So the working relationships that are occurring are functional and collaborative, and I see tangible evidence in the work we're doing. The quality and the efficiency, when we first started safety huddles pre-pandemic, in the middle of consolidation, they were terrible. They took over an hour. We didn't get what we needed. People were spending all their time trying to figure out what I wanted to hear. We don't do that anymore. We just lay it out there. This is what it is. We laugh together, we cry together, and we problem solve together. And the safety, my team has become champions at completing the RL6s. So we really know what's going on. And that's hugely important. I can't help if I don't know what's going on.
Right. Right. And I think what's important to note is that Brenda just mentioned improved efficiencies during the pandemic. Right. So I think that's just worth noting. And I think a couple of things I wanted to add, and there are many signs of improvement. However, like a big part of our collaboration was to measure the impact of the various things that we were doing. And while we continued to gather hard data, as Brenda talks about, to report on at a later date, there were concrete measures indicating improvement. And one of the measures we used, known as the M3, which measures meaning and meaningful work experiences. Now, I won't get into all the domains, but 3 of them are worth mentioning. Meaning at work, especially in tough times, is a driver of engagement, performance, and individual and team resilience. And our measures clearly indicated employees were experiencing higher than we expected levels of meaning at work. Leader quality, which I think was probably the most affirming number, one of the most affirming numbers was that leader strength, the quality employees experience indicating, yes, they're having more meaningful support, helpful support from their leaders. And what's notable is that this domain increased between the second and the third domain, which was affirming and confirming because Brenda's efforts and the efforts of her leaders was being realized. And finally, a notable worth noting is, unlike a net promoter score, which is an indicator of intent to leave, we use a measure that gauges employees' intent to stay. And what was very affirming was that this number, right, and this even when I say this, I don't believe this, Steve and Brenda, right, remained relatively high at a time when burnout and turnover across the health industry was higher than ever, right? And this was just so great to see.
Yeah. Well, that's incredible. Brenda, you mentioned this earlier, and I'm sorry, we got to move on from this slide. I think we could have spent the whole webinar on this slide, but fantastic results. Brenda, you mentioned the concept of lending your calm earlier, and we got a nice picture of the mug you and the board gave to the leadership team. Can you explain this concept and why it's been so significant for you and the team there at Seven Oaks?
Yeah, I think we could have become PhDs in dysregulation in the past couple of years. Like, it has been sort of blow upon blow upon blow upon blow, or perceived as. Well, quite frankly, I don't know how to spin it any other way. It's been hard. And in the education and the training and the practice, as I said, stopping the spin is, we phrased it as lend your calm. And all of my managers received one of these mugs with a Tim's card, and it is our catchphrase. So if you see someone who's upset or uptight, you lend your calm. You also have complete permission to say, I need somebody to lend me their calm right now. Can I borrow a cup of calm? So you can put it out there in a very safe way that people understand. Again, it's back to that common language and what you need, right? So that lend your calm has become part of our culture, of our leadership team, of, hey, I need some help here, and it's okay to ask, and you won't think less of me.
Yeah. And I think what's important to mention as well, that even while we're speaking about leaders, we're talking about leaders in every sector, including physician leaders, nurse leaders, healthcare practitioners, from every level and every area of the hospital. And it's really had a significant impact.
Well, this has been great so far. Brenda, Steve, thank you so much so far. Now we're going to go to the audience for some questions here.
Yes.
There's one question that came in when we talked about the support mechanisms. That list is pretty long. There's 7 on there. Could be kind of intimidating. Brenda, Steve, can you talk to us a little bit about the time involved? I know you said a lot of people gave a lot of extra effort in that area, but you didn't start with a list of 7, right? You that morphed over time and is ongoing. Can you talk a little bit about the time it's taken?
Yeah, I can. Brenda, go ahead. You know better.
Actually, Steve, you start, because I want to make sure I understand the question.
Yeah, so I'm understanding the question, Steve, as like, not only where do we start, but how much time do things take? Is that?
Yeah, and how did you justify that time in the midst of a pandemic?
Yeah, how do you justify? Well, it's interesting because people say, we don't have time for that, and it's like, it's not that you do, it's just how you use it, right? And I think one of the things that we were able to see was that when you make something a priority, and this was what was indicated, and Brenda talked a little bit about this earlier, on paper, everybody would agree that these things are important, right? But what we did is we operationalized those things. So immediate touch points, immediate. So if we believe that connection and communication are critical, then that's where we start. Where are we already connecting? Where are we doing well? And that was a big thing the leadership at SOGH focused on, is not just on where are the stresses, where are we succeeding? And that started to illuminate great things to give us hope and some momentum towards it's not as bad as we think, which creates more time. After that, if it's about communication, well, how do we communicate better? How do we increase this language that we talked about? So it really is about focusing on your strengths, identifying where you're already doing well, and where can you start to lift together a little bit. And what we found was, once you lifted together, you had your lungs were full of breath, and you had energy, and you had hope, which means you could lift a little bit more, and it was pretty impressive. So those are the first couple of things that come to mind. Brenda, over to you.
Yeah, and it really is intentional efficiency, right? So that touchpoint huddle eliminated 3 other meetings, because we didn't need to have those 3 other meetings if we could get what we needed in one 20-minute meeting.
Yeah.
And everything had that level of intentionality. We canceled a lot of meetings. These don't need to happen, but what does need to happen? So we really looked at it through the lens of, what do people need? What do people mean when they ask? And how can we deliver that efficiently, respectfully, and collaboratively? We're continuing to do process improvement, lots of process improvement. And what I would say is, this relationship and communication skills that we've all gained is the secret sauce to really pushing that forward in a way that's sustaining. We've reduced our length of stay dramatically. That is credit to those leaders saying, we can do this. And in fact, in the latest initiative we're doing, there's a bit of a tussle of who gets to go next. So it's a delightful problem to have, I'll tell you.
Yeah. Yeah. And at a time, the level of engagement is unlike anything I've seen before. So once those efficiencies started to take place, like saving time and saving energy, and we started to see more people show up. And as Brenda said earlier in the presentation, at one point, Brenda and I were worried about everything we were giving people to do. So we had a meeting with the community of practice team and said, do you want to put a pause on this? We're in Omicron has started. This has started. You know, all of this stuff is happening. And unequivocally, they all said, no, let's keep going. And when you take an hour and a half in healthcare to do something extra, it's not like you find it somewhere in the day. That's an hour and a half that you get tacked on to the end of that day usually. And I think that's important to know, right? So yeah, the level of engagement was high. It was impressive.
Great. Had a couple more questions come in. I just want to encourage the audience to keep on throwing these in the chat. Brenda, was there any action to address the grief that was associated with the loss of what was, all that was lost due to the restructuring process that took place?
Yeah, absolutely. We created memory books of the ICU and of the surgery program. We had parties to acknowledge and grieve and celebrate. We did the change management pieces that are really, really important in those kind of profound changes. The changes were just so fast and furious. They were extremely challenging.
Yeah, and I think I can also say with the common language, one of the things that was interesting in during such transformation, there's often places that we've been to that say, move on, don't talk about it, it's done, don't look back. Whereas at SOGH, there was a culture of owning and acknowledging and appreciating safety of what was lost, and it was ongoing. So grieving is ongoing, right? And giving managers and team members the communication and the 3 great states to have those conversations. People weren't afraid to talk openly, honestly, and consistently about the things that they lost and also the things and the people that they missed.
But they didn't get stuck in it.
Yeah.
And that's important, right? They didn't get stuck. They lost colleagues. Colleagues moved to other programs or moved with the program to other sites. Yeah, it's acknowledged, it's honored, but we didn't just bury it.
Okay, great. Thank you. We got a couple more questions coming in. Brenda, the support you provided during the pandemic is inspiring. I'm curious, what are some of your plans going forward?
We will continue with the leadership development. We have created a management system here, a frame that we are now incorporating our new language, our new way of relating with people and communicating with each other into the process improvement, into our meetings. We are taking a look at every meeting we have that's under our control and saying, is this the most efficient way to do this? Do we have the right people here? And or do we need to add, or do we need to can the meeting? So we are now embedding this into our other processes. Our HR department is embedding it into their onboarding, into our interview questions, into our performance conversations. So we are really looking as this is a foundational pillar of the culture of Seven Oaks General Hospital, and how do we embed it in a way that it will continue to sustain and grow and develop.
Okay.
I can't add to that.
Yeah, that was awesome. Okay, another question. Has there been turnover in leaders at Seven Oaks? And if so, how do you engage your new leaders at the site? Or is there further one-on-one training and sessions? Kind of a little bit of your previous answer, but maybe you can go into that a little bit more.
There has been some turnover. We have had some people who have worked here 40 plus years retire, leaders, and new ones come on board. That's where the booster sessions generally come in, the booster sessions, and depending on when they came on stream, being part of the community of practice, or being part of the communicating through change, which was the latest offering we gave, people came on. And then we look at what other supports are needed, and that's the ongoing work. Okay, we know there's going to be transition and change. We haven't had significant change in our leadership, other than some of which the system changes have made those changes happen, but not voluntary leaving, I would say.
And I think that's significant, Brenda. I think it across the country, from the other places we work in health and in across the U.S. as well, manager turnover is relatively high in most places, and your manager turnover is relatively slow in terms of voluntary attrition. And I think that that's worth noting. Definitely. Yeah.
Okay.
Middle
Another
managers are
question.
getting crushed. Yeah.
Okay, thank you. Another question that came in: did the process demand people to make big changes from themselves, or a big change in the culture, Brenda? Or did you find that it just fit with the people you had on your team?
I think that's variable, right? I think some people, this felt like, oh my God, this is the sweater I've always wanted to wear. And I think other people have been profoundly challenged. And I'm telling you, in that one live meeting we had in my auditorium, I was surveying my team, and I had some of the crossed arms lean back. This is a bunch of horse hooky. And the one person I'm visualizing is one of the biggest champions I have now. She is awesome.
Yeah. And there's a lot of champions, and it, to be honest, like any structural or culture change in the beginning, it was quiet, it was tough, there was reluctance and apprehension right at the beginning. It was like pulling teeth. But I can attest, as a partner in this, and this comes to all the leaders of the Seven Oaks General Hospital with love. We can't shut them up. We can't stop them from showing up. My problem with some of our learning and development sessions are there's so much positive things to report. I can't manage it all as a vendor, as a colleague, and it's been fantastic. So the difference, yes, the nudge at first needed, but now it's going. And as Brenda was saying, one thing that's really great to hear people say is when they come into a place, and everybody talks about this, culture. If your culture is great, people are onboarded in an organic, language-driven, values-based way where the conversations is the onboarding, how people model is the onboarding, right? We don't need courses every single time. So I think that's really important to notice, and that's what we're seeing with the Seven Oaks General Hospital. Yeah.
Okay, great. Well, thank you, audience, for questions. I just want to encourage you can continue to ask questions. I'm going to provide some ways to reach out to keep the conversation going as well. But Brenda, thank you so much for sharing with us today. This has been phenomenal. If you had to share one final thought with our audience today, what would it be?
It's going to be big because I wanted to share thoughts. It's all about the relationships. That's what I really want to say. We spend a ton of time on energy, on policies, on guidelines, on standard work, on procedures, on improvements, and that's all very important for our business. But we found that focusing that time and that energy on being intentional and disciplined around how we connect and how we communicate and have a shared language is gold.
Yeah.
Okay. That's great. Thank you so much for that. And Steve, you've done a wonderful job of communicating as usual. Why don't you tell us what some of your final thoughts are, your final thought is?
First off, I want to thank Brenda and her people at Seven Oaks General Hospital for trusting us on this incredible journey and for inspiring us to know that greater is better and possible. My final thoughts to the amazing people that showed up today. Thank you. Don't wait. When you stop, the good things drop, right? Make leadership strength a priority. Don't wait. Use the resources that you have available to you to get started and realize you don't have to do this on your own. I think that's really important. Brenda used the resources she had available, reached out for help, and leveraged what she could immediately. Her people are coming out of the pandemic. They're not crawling, they're not walking, they're running. You don't have to do it all, but you must do something. And I think pick one thing and just get started. And the last thing I want to say is know that we at Brivia have always been here. We will always be here to help. And our promise is we will get you to better together. So thank you very much, Steve. And Brenda, thank you so much. And everybody else, I'm going to pass it back over to you, Steve. Thank you.
Great. Awesome. Thanks so much, Steve and Brenda. And folks, we're going to get you out of here at 10:45 as promised, or 10:45 Mountain Time. Just wanted to give you a couple connect points. Contact at brivia.consulting with questions. You can check us out on YouTube and LinkedIn. And as a part of a follow-up, we're going to be sending the recording to you afterwards. So I want to thank everyone for joining us today. Thank you so much for your time. Reach out. Let's continue the conversation. Brenda, you were awesome as always. And Steve, thank you for adding to this.
Thank you.
Thank you, everyone. Have a great day.
Thank you so much, everyone.